Over the weekend, actress and star of Beverly Hills 90210, Shannen Doherty, passed away on Saturday. She lost her battle with cancer after many years of fighting the disease. She had stage 4 breast cancer. Now we're seeing more and more patients getting diagnosed with cancer at a younger age.
And here to explain more about this is our 9 News health expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
We know that Shannen Doherty died very young from breast cancer. She was diagnosed at age 44 in 2015. Talk to us a little bit more about a breast cancer diagnosis like this, especially in young women.
It's such a tragic loss of such a talented actress, and unfortunately what we are seeing is that more and more young women are getting cancers, more are getting breast cancers. In fact, breast cancer is the leading cause of death in women under the age of 50, and unfortunately their cancers tend to be more aggressive. Now, we're not sure what the reasons are for some of these earlier sort of manifestations. We think it's a whole host of reasons, some of it lifestyle factors, some of it genetics, but some of it is also screening and lack of education amongst the young women.
So when should women start to get screened?
I say to women, my female patients, in your 20s and 30s is when you start to think about your risk of breast cancer. And for the average woman, she'll start screening around the age of 40. She'll get a mammogram every year if you're sort of average risk. There's some debate and controversy about whether every year or every other year, but the American Cancer Society says every year is better. But for a lot of women who have BRCA, like Angelina Jolie and others, you may even want to start earlier. If you have a family history of somebody who had an aggressive cancer, start earlier. If you have dense breasts, which you can't tell by feeling, you have to see on a mammogram, your risk of cancer is actually higher. You may want to start earlier. So I like to say in 20s and 30s, you go on the website, there's a breast cancer risk calculator. You put in your numbers into that. You put in your family history. This is for people who don't have BRCA and for people who don't already have cancer. And it will tell you what your risk is of breast cancer and kind of offer suggestions. So every woman's risk needs to be personalized.
And while you're waiting for that day to get tested or you're in between tests, are there lifestyle changes that we can make to help reduce the risk of breast cancer?
I mean, this is really interesting because there was an article that just came out in New England Journal of Medicine that says we're giving ourselves cancer based on our lifestyle choices. So there's plenty of things you can do that are associated with the reduced risk. So first and most important, alcohol. There's a dose-dependent relationship between how much alcohol you consume and your risk of breast cancer. Second, physical inactivity, which is associated with a much higher risk. Having a diet high in saturated fat, eating a lot of processed foods, that's associated with higher risk as well. And obesity, having extra weight on you. These are all lifestyle factors. Now there's reproductive factors as well. So if you haven't carried a pregnancy to full term, you're higher risk. If you take combination birth control pills like oral contraceptives, which a lot of women take, that can be associated with a higher risk as well. So talk to your doctor again about your risk and how you can minimize it.
What are some of the emerging new therapies for breast cancer beyond chemo and radiation?
This is really interesting, actually, because Shannen Doherty actually alluded to some of these. She got chemo, radiation, and surgery, which is kind of the top of the line of what we have now. But we're thinking about using your immune system to outsmart the cancer. So what happens if you find a cancer, take it out, radiate it, give it chemotherapy? When microscopically it recurs, you don't realize that until it starts to spread to other organs. So if you could use your immune system, and this is called breast cancer vaccines. So if a woman has had breast cancer, you take the tumor, you teach her immune system how to recognize that tumor so that if it comes back, even on a microscopic level, that immune system can start to fight it.
Wow.
And I hope everybody's paying attention because breast cancer is not just a women solely issue. This is happening with men too.
It is. In fact, I lost a good friend of mine from medical school to breast cancer. 1% of breast cancer is male breast cancer. And a lot of times men don't obviously screen, they don't self-examine. But if you have pain in your breast, whether you're a man or woman, puckering of the skin, changes in the way the nipple looks, even a rash on your breast can be a certain type of breast cancer. It's really important to go and get that checked out.
Just got to pay extra attention to your health because you know if something's up, you know if something's off, so you got to pay attention. Dr. Kohli, thank you. And you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.